Hello, welcome to the Healthy Weight Management Department at Penn Medicine, Lancaster General Health. This online seminar is for patients interested in non-surgical weight loss options with a focus on improving overall health and wellness. This includes our New Direction Meal Replacement Program. The New Direction program runs for 14 weeks and is typically offered 3 times a year. If you are not interested in the meal replacement program, we also offer individual weight management consultations for patients. If you are interested in weight loss surgery, please visit lghealth.org/healthyweight to sign up for a surgical seminar. After you complete this non-surgical seminar, you can enroll in one of our upcoming New Direction sessions or schedule an individual consultation. Our team of non-surgical providers includes Dr. Virginia Ray and Dr. Larry Weger, both of whom are board certified in obesity medicine, as well as nurse practitioner Annie Girolamo.
Hi, this is Dr. Virginia Ray, and welcome to the seminar. The purpose of this presentation, number 1, is to discuss the impact of excess weight on health. Number 2, to provide an overview of medical weight loss services provided by Lancaster General Health's Healthy Weight Management and Bariatric Surgery. And number 3, to provide information on our very low calorie and low calorie diet 14-week programs. So we're going to start with looking at obesity trends. We've had an obesity epidemic going on for the last several decades. And if you look at the transition from 1990 to 2000 and 2010 on the maps, you will see a progress from blue to darker blue to yellow, red, and darker red colors, which signify increasing rates of obesity throughout all of our states, and many states having obesity rates over 30%. The next map shows our latest map data from 2017, which show continued progression in all of our states, with some states having obesity rates over 35%. And moving from the maps to our largest CDC studies, we learned that more than 70% of Americans are either overweight or obese. And as we compare that with our local data here at Lancaster General Health, we see the numbers are even greater, with close to 50% of our patient population in the obesity range. Even more concerning is obesity prevalence in our children. Nearly 1 out of 3 children are overweight or obese, and nearly 1 out of 5 fall in the obesity category, and this rate has tripled since the 1970s. Estimates show that half of teenagers will be obese by 2030, and what that means is this is the first generation of children that possibly will not live longer than their parents. So what's the key problem going on here? Well, studies show that as a nation, we are definitely eating more calories. From 1970 to 2002, Americans are eating at least 200 calories a day more than they did. And just to put this in perspective, an intake of 100 calories more per day than we need can result in 10 pounds of weight gain per year. As an example of how things have changed over the years, a cheeseburger 30 to 40 years ago averaged about 333 calories. But today, a cheeseburger is usually at least twice that, with some restaurants touting burgers with buttered buns and bacon that can run you more than 2,000 calories each. Another example, French fries. 30 to 40 years ago, remember that little paper bag? At about 210 calories. Well, today, most French fry portions are 3 times that, with 3 times the calories. And often those meals include a soft drink. And 30 years ago, that soft drink was typically about 6.5 ounces. And today, an average soft drink is about 20 ounces with about 250 calories of sugar, with a 20-ounce soda averaging about 16 teaspoons of sugar. Another example is coffee, which 30 years ago came in a small cup and saucer. But today, average coffees can run you 350 calories or more, with local restaurants having frappes that run over 600 calories. And that's before you even have your breakfast. Another problem is we are not as active as we used to be. In this photograph, you see a picture of Grand Central Station. The central area is the stairs, and on either side is the escalator. And what this shows is a natural tendency to take the path of least resistance and not be active if we don't have to. So let's talk about some environmental factors. One big item is greater access to food with poor nutritional quality, and it's easy to underestimate your calories. Such as the soft drink we mentioned, you may just be thirsty and get something to drink without realizing that you're piling on another 250 calories worth of sugar. Other items are prepackaged and fast foods, soft drinks and specialty drinks like I mentioned, increased portion sizes, underestimation of calorie intake, eating out, lack of activity, labor-saving devices, increased screen time. I see this especially in children that normally could not sit still, will sit still for hours in front of a screen and not get the activity that they need. And there are also many socioeconomic factors, although obesity crosses all lines. Psychosocial factors are definitely playing a role. Folks use food for reasons besides nutrition, such as emotional eating. There are food associations in childhood. We are rewarded with food from the time we're very small. There are too many food choices. You can put 20 different varieties of potato chips in the cart. There's social eating. Parties, socials, and holidays are often centered around food. And a big problem I'm seeing is distracted and mindless eating while folks are on their screens and devices. We'll now move on to the classification of body weight. We use body mass index, or BMI, as a screening tool to determine if there is a risk related to someone's weight. BMI is based solely on an individual's height and weight and does not take into account any other factors. So it is just a screening tool that healthcare providers use to see if there may be a risk related to an individual's weight. A BMI that would be most concerning to a healthcare professional would be a BMI under 18.5, which could mean there are risk factors related to being underweight, or a BMI over 30, where risks can increase that are directly related to weight. When a BMI is over 40, that is often called morbid obesity. Morbidity means disease, and what this simply means is that the risk for disease is higher with a BMI over 40. You can calculate your BMI at home with a simple equation. If you take your weight in pounds and multiply by 703, then divide by your height in inches, then divide that whole number by your height and inches again, and that will give you a good estimation of what your BMI is. The reason there is concern with your weight in a high-risk category is that it can have impact on all of your organ systems, including your lungs, your liver, your gallbladder, your reproductive organs. It can cause increased pain related to both gout and osteoarthritis, can increase cancer risk, increase risk for diabetes, and heart disease. So health risks related to obesity can affect both the quality of your life and can cause premature death. So talking more about health risks related to obesity, compared to adults of normal weight, adults with a BMI over 40 do have an over 50% higher risk of high blood pressure and a 34% higher risk for osteoarthritis. And patients with a BMI over 40 can also have a 4 times risk of developing cancers. More than half of all cancers diagnosed in women and about a quarter of cancers diagnosed in men are associated with overweight or obesity. So let's talk about obesity and diabetes. It is estimated that 1 in 10 American adults have diabetes, but this number may actually be artificially low because many folks do not know they are having an elevated blood sugar. This is projected to be 1 in 3 by 2050 and will be a tremendous strain on healthcare resources. Over 60% of type 2 diabetes appears to be related to obesity or weight gain. And for every kilogram, that's 2.2 pounds, increase in body weight, the risk of developing type 2 diabetes rises by about 6%. It is estimated that 3 out of 4 new cases of diabetes can be prevented by maintaining a normal BMI. Looking at obesity and heart disease, studies show that overweight participants had a 32% higher risk of developing heart disease, and obese participants had an 81% higher risk of developing heart disease. So you can see how that risk goes up once the BMI goes over 30. On the left side of the screen is a heart from a healthy weight individual. Contrast that with the heart on the right side of the screen from an individual with increased visceral fat. Even someone who has a BMI that is not terribly high, who has an increased waist circumference, can have increased visceral fat, which can get under the muscle layer and around the organs and stress our organs, such as the heart and liver. I think it's about time for some good news. Weight loss can prevent the occurrence of health problems related to weight. Weight loss also improves existing problems related to weight. And you don't have to achieve a normal weight to experience health benefits. A weight loss of just 5 to 10% can have huge health benefits. Looking at weight loss and how it impacts type 2 diabetes, losing just 10 pounds over 2 years decreases the risk of developing diabetes by 30%. And every kilogram, that's 2.2 pounds of weight loss, for an individual with glucose intolerance, that would be pre-diabetes, decreases the risk of developing diabetes by 16%. That's with each kilogram. Looking at the weight loss benefits on heart disease and heart disease risks, weight loss significantly decreases major heart disease risk factors. A weight reduction of just 10 pounds over 6 months of nutritional supervision yields 30% less heart disease risk. So knowing how important it is to lose weight if you're overweight or obese, why isn't everybody doing it? The formula seems pretty simple, right? You eat less and move more, but that is not the case. Studies show that the human body is very adaptive at making traditional dieting difficult for someone who is overweight or obese. Certain medical conditions, genetics, or the effects of medications can make it harder to lose weight. Also, a calorie is a calorie theory has been proven not to be true. For instance, a calorie that comes from protein behaves completely differently in your body than a calorie that comes from a carbohydrate. So what are your weight loss options? Well, there are traditional calorie reduction diets where you stay under a certain amount of calories on a daily basis. There are also macronutrient-focused diets such as a high-protein, low-carbohydrate diet or a low-fat diet. There are comprehensive individualized behavior modification diets that are specific to each individual. There are also very low-calorie diet and low-calorie diet programs. Weight loss medications can be utilized, and bariatric surgery is also an option. So in the weight loss options, I mentioned comprehensive individualized behavior modification with the medical management program. What this means is we use a team approach. This includes the medical provider, such as myself, registered dietitian. We have exercise physiologists to help you get going with an exercise program that's right for you. And often referral is made to psychologists or therapists that can help you with the emotional component of eating. We evaluate obstacles to weight loss. We focus on proven methods such as My Plate for portion control and balanced fueling and healthy food choices. We find it more helpful to focus on calorie awareness rather than simple calorie counting. And we stress a medically significant weight loss, which is actually 5 to 10% over 6 months, which comes out to about a pound or 2 a week. Now, this may not seem like a lot compared to what's advertised to you on television and the media, but it's what's realistic and what is healthy for the human body. Sometimes weight loss medications are used to help augment the lifestyle modifications. However, you need to be aware that weight loss medications are not a cure-all. They can help by decreasing appetite, reducing cravings, helping you feel more full, or even changing how you absorb some of your nutrients, but they must be used in conjunction with diet, exercise, and behavior changes. It is important to realize that results are not dramatic, with most studies showing that FDA-approved medications show a weight loss of 5 to 9% in 1 year, and this is considered successful. It is also important to know that weight loss medications cannot be used with certain medical conditions or certain medications. Bariatric surgery may be an option for an individual whose BMI is over 40 or more than 100 pounds overweight, or if their BMI is over 35 and they have serious medical conditions including diabetes or obstructive sleep apnea. The most common procedures in the U.S. are the vertical gastric sleeve and the Roux-en-Y gastric bypass. Patients can lose 50 to 70% of their excess weight over time, and some procedures show immediate improvement in diabetes and hypertension. But bariatric surgery is not the best option for everyone. Completing this seminar is a requirement for these programs, which use meal replacements and are lower calorie than traditional diets, but maintain adequate protein. These programs are medically supervised. The VLCD program, or very low calorie diet, produces ketosis, which decreases appetite and burns body fat at a higher rate. Both programs typically result in a 10 to 15% weight loss over the 14-week period. It is important to realize that any program that produces a rapid weight loss, such as a VLCD or even bariatric surgery, are just tools. The real success comes from the long-term commitment. People often think if they could just lose the weight, then everything would be great, but keeping it off is actually the longer end of the journey. Lifestyle change is crucial to success. It is also very important to note that the ketogenic diets can have a lot of health risks and should never be a do-it-yourself diet. New Direction is the name of our VLCD and LCD program. New Direction is a medically supervised program for rapid, safe weight loss. It includes nutritionally complete meal replacements, close medical supervision, and a focus on education and support for long-term weight management, not just the short-term diet. The meal replacements we have chosen for the program are in the form of shakes, puddings, soups, bars, and other types of nutritional drinks that contain the right mix of proteins for good metabolism. Not all meal replacements are created equal, and we have chosen our brand of supplements to provide the right mix of proteins and nutrients for good metabolism. The benefits of a very low-calorie diet are specifically significant with type 2 diabetes. We typically see a body weight loss of about 10%, a drop in the fasting blood sugar of about 26%, a drop in cholesterol, triglycerides, and both the top and bottom numbers of your blood pressure. So who can participate in a very low-calorie diet or a low-calorie diet? Well, it needs to be adults over 18, and you need to be at least 20 pounds overweight, have no medical contraindications, and be motivated to commit to the strict program and necessary medical supervision. Individuals who would not be good candidates for the program would be anyone under the age of 18, anyone with active metastatic cancer, anyone currently taking prednisone, lithium, or possibly certain other medications, which we would evaluate for at your initial visit. Type 1 diabetes, active peptic ulcer disease, active inflammatory bowel disease such as ulcerative colitis or Crohn's disease, liver disease that is severe requiring protein restriction, or chronic kidney disease that also requires a protein restriction. If you had a heart attack within the last 3 months, we would wait on that. We also would want to wait until after pregnancy and breastfeeding is completed. This program is not recommended for individuals with significant mental illness or learning disability. We also would not recommend this meal replacement program if you have a sensitivity to artificial sweeteners or an allergy to milk or soy. So there are 2 specific program plan options in the New Direction program. The first one is called VLCD, or very low calorie diet, and the second is called LCD, or low calorie diet. So for the VLCD, this is ideal for women with more than 40 pounds to lose or men with more than 50 pounds to lose. The anticipated weight loss with this program is about 3 to 5 pounds per week. The caloric intake with this diet is about 800 calories per day, and it is a ketogenic diet. What that means is the body converts from using carbohydrate for energy to burning fat as its main energy source. The appetite is also reduced due to the ketosis. During this 14 weeks, you will consume only the New Direction products and eat no regular food. The low-calorie diet is indicated for men and women with 10 to 40 pounds to lose, for whom the VLCD is not appropriate or not desired. The anticipated weight loss for this program is about 2 to 3 pounds per week. In this program, you consume about 2 to 3 New Direction products daily and 1 balanced meal. This is not a ketogenic diet. So which plan is best for you? We will help you determine that at your first visit. This joint decision will be based on the amount of weight you would like to lose and the impact each plan may have on existing medical conditions. So there are different phases of the LCD and VLCD program. There's the initial medical consult with screenings that occur at the first visit, and then we enter phase 1, which is the reducing phase of rapid weight loss. Phase 2 is the adapting phase, and phase 3 is the sustaining phase. Let's talk about each step of the process. The screening. Screening will be completed during your initial medical consult, and this includes a history, a physical exam, some lab tests, possibly an EKG, a behavior questionnaire, and enrollment forms you need to complete. So phase 1 is the reducing phase, and this is a rapid controlled weight loss. Only New Direction products are used except for the one meal for the LCD patients in this phase. There is careful monitoring by the physician and staff. You will attend weekly classes with topics in nutrition, behavior change, and exercise. We will help you develop a structured exercise program with our exercise physiologists. This phase of the program usually lasts about 14 weeks. Phase 2 is the adapting phase, where we gradually reduce the New Direction product use and begin to add table food to your daily diet. This begins when you are within 5 to 10 pounds of your goal weight and typically lasts about 5 to 10 weeks. Carbohydrates must be reintroduced slowly to prevent water weight gain and increase in hunger. During this phase, you will meet individually with the dietitian to work on your specific meal plan. Phase 3 is the sustaining phase. You will transition to regular foods, practicing the lifestyle skills that you have learned in the program. You will work closely with the dietitian to adjust calories and macronutrients in your meal plan. You will continue with exercise and increased activity that are really important to keep that weight off. So let's talk results. At the end of our program, at about 13 weeks of product use, we see an average weight loss of about 35 pounds, which is about 15% of the average body weight. That is more than enough to see significant improvement in health issues. The average weekly weight loss is again about 3 pounds a week for the VLCD and about 2 pounds a week for the LCD. Now the big question everyone wants to know about the costs, and that's important. Medical visits and tests may be covered under your insurance depending on your weight and medical problems. But be aware that not all insurances cover weight loss services, so you will want to check with your insurance. Keep in mind that meal replacement products are not covered by health insurance plans, and there is a small fee for the weekly classes. However, you may be able to use flexible spending or health savings accounts. You can check with your employer on that. Certain expenses may be deductible for income tax purposes. Costs average $60 to $100 per week for the products and classes, depending on the amount of products you need per week. Remember, though, if you're doing the VLCD, you will not be buying regular food, so you'll be saving on your grocery bill. Now, just to clarify the New Direction program availability, the New Direction program is offered 2 to 3 times per year at specific times, as the classes are led and coordinated by our team of healthcare professionals and must be scheduled ahead of time. So after completing this seminar, please contact our office if you would like to know when the next series will begin. However, you don't have to wait. You can get started with an individualized weight loss program with our medical weight loss providers while you're waiting for the next program start date. Okay, so what's next? You finished the seminar. Good job. Now, you still may not know which program is best for you. So just give us a call to schedule a new patient appointment with one of our providers, and we'll be happy to guide you. Thank you for taking the seminar today. We look forward to helping you on your journey to better health.